Many times people come into our practice and they've spent many dollars on their mouth, and you look in their mouth and you find that they have optimal repair, which is dental materials that are supposed to last a long time, and they're placed in less than optimal conditions. And so I want to talk about the difference between optimal repair and optimal health. In so doing, I want to explain to you the cause of dental disease. Enamel on a tooth structure, is the outer tooth structure, is the hardest thing in your body. Plaque, which is an acid, eats away at that enamel. Now, it takes many hits of acid to break that enamel down, and when it does, the dentist has to come in and put a filling in it to plug up the hole. If he doesn't, then the tooth will still continue to decay. When that occurs, if a person doesn't know what causes that problem, then the filling gets bigger and bigger until maybe a dentist will say to you that you need to have a crown on a tooth. Now, the truth is that you don't need to have a crown on anything. It's designed for a reason. A crown is designed, it's made out of porcelain, to cover the tooth, to protect it, to keep it from cracking, or the filling becomes so large that it doesn't last as long. But when placed in less than optimal conditions, a person will not have optimal health. Most of the time, dentists are shingling the house while the house is on fire. So unless you know what the cause is and your effective ability at removing the cause, you could be spending a lot of money and still find that you're back at the starting gate, that you're not really getting healthier while going to the dentist. Now, inside of our dental practice, we have a way of being able to approach things in a coordinated manner. So the first thing that we have is that we want to make sure we have good, healthy gum tissues. If the gum tissues aren't healthy, then you're going to have inflammation. The thing we are concerned about in inflammation is not only because you bleed all over in your mouth when touched, but it's also the same inflammatory processes going on in your organs inside your body, like your heart. So the same inflammatory processes going on in the mouth can occur in your heart, your lungs, liver, all these different organs that could put you at great risk. So we make sure that we have good, healthy gum tissues first. Then we want to make sure that there is no tooth decay. If there is no tooth decay, then we also want to make sure that the teeth are functioning properly as part of a chewing system. Then we restore the teeth in a long-term way when we make sure that you know how to take care of it so that it doesn't break down, and it could very well last the rest of your life. So optimal repair will then equal optimal health if three things are taking place. One, you have good, healthy gums. The other is you know the cause of disease so that you keep the plaque off of your teeth that causes that problem. And the third is that the teeth are functioning properly so there's no increased forces that are going to either mess up your teeth or your joints. That way you keep your system healthy. We work on your smile, and then people often ask us, "Doctor, you are helping us become so healthy. Is there any physicians that actually take that same approach by helping us to get healthy instead of just prescribing medications to us?" I have assimilated a team of people that will actually help you in all ways, not only get healthy orally, but also help the rest of your body to stay in that good condition so that you can maintain a high quality of life through the rest of your life.